While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body podcast. So, barefoot training. We've heard about that for a while. Most of us have. But there's a lot more to it than just going barefoot, going from your normal sneakers or high top sneakers to training barefoot. So I brought in a world-renowned specialist in barefoot training and a board-certified podiatrist, Dr. Emily Splichal. Did I get that right?
It's Dr. Splichal, but it's okay. I go by Dr. Emily. So we're good.
Okay.
We can drop the last name.
There we go. Well, welcome to the show. Thanks for being here. So let's just kind of dive right in. I remember, being in my doctorate program, and I was a big fan of barefoot training. I worked out, I would deadlift or squat barefoot. I tried to work in all three planes of motion, and that was, to my colleagues, that was just kind of, outside of they thought what I've done off the D.P.M essentially. So talk to us about barefoot training. How long? I mean, obviously it was around way back in the day because there were no shoes, but there's been an explosion of it the past 15 years or so. Can you talk about that briefly?
Yeah, absolutely. So a lot of people will think of barefoot training, they will go towards barefoot running. So I just want to first start off by differentiating that barefoot training is not the same as barefoot running. To strengthen your feet and to wear minimal shoes does not mean you have to run in them. But a lot of this attention towards it started in 2008, 9, 10. So like you had said, roughly 15 years ago, when the book Born to Run came out, which was in parallel with when the Vibram 5-finger, so kind of the 5-toe shoes, Nike Free, those were really the two that first kind of hit the footwear industry with the minimal shoe. And that brought an awareness to the footwear industry and just foot health in general and movement health, as far as how it relates to foot function, natural freedom of the foot. And then, of course, as people who followed that boom knew that Vibram had lawsuits against them, and there were a lot of issues because of this inaccurate association that to have strong feet, you have to run barefoot. So a lot of that then shifted towards where I now build my practice, and I travel and speak a lot about barefoot training, or really what I call having a barefoot strong lifestyle, which just means you're thinking about your foot health, you recover your feet, you sensorily stimulate your feet, and you do something every day that integrates foot health into healthy posture, healthy movement.
Right. Yeah. I was trained to look at the entire kinetic chain, not just one joint. Always at the bare minimum, evaluate the joint above and below the site of pain.
Mm-hmm.
And I remember reading, once the NBA started implementing these high top shoes that puts you in plantar flexion, the rate of knee injuries just exploded. Can you comment on that?
Yeah, so you're correct in that you would assess above and below, right, where maybe the issues being presented. But the big thing is that, yes, everything is connected. Every restriction in a joint perhaps is ultimately going to influence up the entire chain. So it could be a right ankle issue that's presenting in the jaw. Like that would not be impossible because of how interconnected the body is. And the body is interconnected from a joint coupling perspective. So that would be you plantar flex the ankle and it creates a rotation in your lower leg or your tibia, to also fascial lines. So muscles and soft tissue in the bottom of the foot continues all the way to the top of the head. So that's where you can also get an influence from, again, joints, but also fascial lines and soft tissue. So you'll see that in footwear changes, restrictions in footwear, stack in footwear, heel toe drop, which is what you're referencing with the basketball shoes, which is putting them in a plantar flex position. Ultimately, they influence the ankle, which influenced the tibia, which affected the hip joint all the way to the pelvis. And then ultimately it was unfortunately the knee that got the short end of the stick, and they were seeing certain injuries presenting there.
Yeah, and so you have your own Barefoot Training Academy. So when someone comes to you, let's say a patient or a provider who wants to know more about this, do you take people and gradually titrate them in terms of going from their shoes that they walk in the door with to a barefoot or minimalist approach?
Yes, if their foot deems that appropriate. So generally for recommendations when I look at shoes is I look at foot type, injury history, and then the demands at which you're going to put that foot under. So if we start with foot type, if someone has extreme ligament laxity and a flexible flat foot, they may not tolerate the minimal barefoot shoe. I could modify that though. I could put them in a more minimal shoe and put a arch support in the shoe. You can absolutely use an orthotic in minimal shoes. You don't have to have extreme structure around an orthotic. So that would be one example. Injury history, let's say the patient or the individual presents with recurring plantar fasciitis or fasciosis, heel pain, and they're trying to transition into the minimal shoes. It may or may not be appropriate. Again, it depends on then the third, which is the demands that they're going to put their foot under. And let's say the individual is trying to transition to minimal shoes, but they stand on their feet all day for work on concrete. I would not advise that because you are now defying physiology and the natural stress that the foot can tolerate. So that's why I always want people to think about, okay, structured shoes, there's a time and a place and appropriateness for it. Minimal shoes, time, place, appropriateness for it. And then the three criteria that I look at is foot type, injury history, and then the demands that you're going to put the foot under. And then I would transition them.
Yeah, I think context is really important, and you've given us some great context to sort of evaluate these situations from. Do you look at, so when we talk about movement, yeah, I know you know this, but for the listeners' sake, walking, from a gross 30,000 foot viewpoint, we're mostly in the sagittal plane, snow angels, frontal plane, rotation, transverse plane. So do you look at, say, the hip cuff, the glute medius, minimus, etc., in terms of its ability to control the valgus collapse of the knee?
Yes, and actually, there's research that shows that you can do in specific presentations of the foot 6 to 8 weeks of glute strengthening, primarily the external rotation moment of the glutes, to control rear foot valgus or rear foot pronation. And these research studies that demonstrated saw that you could get 2 to 3 degrees of a correction in the rear foot through 6 to 8 weeks of glute strengthening. When I see a foot that has mild rear foot pronation, maybe some mild knee valgus or collapsing inward of the knee, kind of that internal rotation, then instead of pushing them to orthotics, I would rather do the strengthening protocol, because the standard correction on an orthotic is 2 to 3 degrees. So if I can achieve that through strengthening the glutes to better control the knee and ultimately better control the foot, I'm going to do that first. If they don't respond, if they're non-compliant, if it's too difficult for them to do that and kind of maintain that, then yes, I could see where using the orthotics to create that correction to support the knee. But even when I do orthotics, I never do, here's the orthotic, have a nice day. There's always an orthotic, and an exercise protocol. So I always do a combination.
Absolutely. Great. And you mentioned, a time and a place for everything, which I agree with. The really big high top shoes with the really thick heels. Do you think there's limited use for those, regardless of the person's sort of structural makeup?
I'll give you an example of a shoe that is very trendy now. It would be Hoka. And Hoka, which is a high stack shoe, it's zero drop. So you don't have the drop, but you have the stack. I don't like the stack because it creates a sensory disconnection between your feet, your nervous system, and the ground. And all of that cushion is just taking all of that important information. However, what I do like about the Hoka is that it has a stiff forefoot rocker. So certain people benefit from that feature of the shoe. Let's say they have a hallux limitus or a neuroma or a plantar plate tear and something going on with the second MPJ. I really like to utilize the stiff forefoot rocker of the Hoka for them, so then they can maintain an optimal step length, or as optimal as they can of a step length on that. To combat the stack, I then say, we'll use something like a Naboso insole or bring the sensory into the shoe to then try to offset that disconnect. But in general, if we're just talking high stack, super foam shoes, which are very trendy now, it's just trendy to have very bulky shoes. Generally, I don't like them because of that disconnect from the ground.
Right. And, we have basically three regions or three areas that feed the brain: eyes, ears, and proprioception. So, talk a little bit about brain activity and how that might be altered by losing our connection with the ground.
Yeah, so when we look at the foot, or you think about the foot, it is a very sensory rich part of the foot. And there's actually two different types of input that you get to the brain from the foot and the ankle. And that's going to be proprioception, which you mentioned, that one. The second one is actually mechanoception or touch. Proprioception is what you would find in the joint, so the joint capsule. So when your ankle, let's say you're on like a wobble board and your foot and ankle are wobbling, right? That's called noise. You're essentially stretching the joint capsule and the ligaments and the tendons, which have the nerves, which then feed the brain to send a signal to control the ankle and your center of mass. That's proprioception. Mechanoception or touch is found in the skin in the bottom of the foot, which is glabrous skin. So this is different type of skin than the rest of your body, glabrous skin. Mechanoceptors respond to mechanical deformation, which is based off of weight bearing or touching something. And those nerves, research has demonstrated, are actually faster than proprioceptors.
Okay.
So when I work with, let's say, an ankle sprain, we know there's a disruption in the outside of the ankle, which is proprioceptive, but research has shown that there's also a disruption in mechanoception. So I want all of my ankle sprain patients to do their rehab barefoot. I want them to be stimulating the skin in the bottom foot, either with some of the Naboso products that I developed, with a vibration platform, on a hard surface. I want them really accessing those nerves at the same time as the proprioceptors. So it's not just as simple as, say, standing on a Bosu or an Eric's pad, like a piece of foam. Those are very proprioceptive modalities. You also need to think about, how do I stimulate the nerves in the bottom of my feet? Because they work together. And as I had said, the mechanoceptors are actually faster than the proprioceptors.
Yeah, you mentioned the vibration plate. I use it for lymphatic health, bone density, sort of to get the stabilizing muscles firing before a workout. But how does that play a role in your programs and protocols for patients, and what's clinically appropriate in terms of use?
Yeah, I absolutely love vibration platforms. They're an awesome way to activate the muscles, activate the nervous system. Research has shown that they increase microcirculation to the feet. So you would get an increase in skin blood flow, soft tissue blood flow. Obviously, blood flow goes to your nerves. So it's very important for peripheral nerve health. Great way to stimulate bone density because the vibration is essentially mimicking impact forces. So when we walk or we run and you experience ground reaction forces, those are actually perceived by your nervous system as vibration. So a vibration platform mimics dynamic movement, right? So then you get all of these benefits. So in my practice, I use it as a way during movement prep is an awesome way. So you would do your first, 5-10 minutes before you run on the platform to prepare the feet, the muscles, the nervous system. I use it a lot with my neuropathic patients or patients that might have balance issues. So they don't get the sufficient number of steps to maintain bone density or circulation health is another really good one. And then anyone who's coming off of an injury. So let's say like a fracture, the latter part of the fracture, you actually want to stimulate vibration to accelerate that last 10% of bone healing. So it could be kind of interwoven creatively depending on what the goal is. But for the most part, like for my mom has one and she does 15 minutes a day. She'll stand on it, just do a little isometric squat. You can, step on and off. You could sit in a chair and just put your feet on it. But the dose that I have people do is 15 minutes once a day.
Awesome. Well, thank you for that thorough answer. Some questions that various people submitted. One is, how do you go about deciding which barefoot shoe or minimalist shoe is correct for you?
So some of the minimal shoe becomes a little bit of preference, right? Meaning you have an aesthetic. There's still a fashion piece, right? Shoes and footwear are still fashion. So what color do you like? Do you want a sneaker? Do you want a lifestyle? Do you want a hiking boot, a sandal, right? So there's a little bit of that, which is just personalized. But for general features, you're looking at is the shape of the toe box. Is the shape and width of the toe box friendly to your foot shape? If you have bunions, obviously that's going to modify your needs a little bit more. You might need to be a little bit wider. The fabric that is used for the upper is also important because you want to have a little bit of stretch in the upper. Also, the height of the toe box is important. The height of the toe box, let's say if you have hammer toes, is important because you don't want to have any rubbing across the top of the shoe. Then when you're looking at the drop and the cushion, most minimal shoes will be more zero drop, which means they're between 0 and 3 millimeters of a decline. Although there's some really good shoes that have a 5 millimeter drop. Topos and Ultra are two of the most well-known that have a 5 millimeter drop. Still wide toe box, stretchable upper. The fabric you can choose. Do you want vegan fabric? There's many things on that. And then it would really be the functionality of what you're going to use them for. So what are the treads on the outside of them? As an example, a kind of a classic Vivo Barefoot sneaker on the outsole, the sole is actually pretty flat and not slippery, but it's not designed like a hiking boot, where some of the shoes by Zero Shoes, which have a different last shape, are known to have better treads on the outside of them. So that again becomes a little bit activity dependent. So that's how I would start to think about and look at minimal shoes and how you would decide on them.
And when someone's just starting out, I know it's going to be patient specific, but in terms of like, say, a titration schedule, would you start someone out 30 minutes a day wearing minimalist shoes if they've been in a traditional shoe, or an hour a day?
So I would typically say, so let's assume the person who's transitioning from supportive to minimal works out, let's just say, then that's typically an environment that it is the best and the easiest situation to transition initially. So I'll just say when you go to the gym and you are doing your group exercise class, your lower body, whatever you're doing at the gym, wear the minimal shoes there because you are in a controlled environment. I'm assuming they're probably working out maybe an hour. So you have this hour exposure to a minimal shoe. Then after you're doing that for a while, you can then start to transition, like you had said, okay, I'm going to wear them around the office. I'm originally from New York, as we discussed earlier, which is a walking city. So it was very much part of my practice to help people who have to walk for part of their commute to how do they transition. So in that example, I would say do not commute in your shoes because you have to walk all over the city. Wear them when you get to the office. So again, we have a controlled environment, right? Now you have work from home. So it makes it a little bit different. But if you are running to the grocery store, okay, wear them for that. But so you just want to kind of be intelligent on how you do it. And then I would give another word of advice is that as people transition from supportive shoes to minimal shoes, you want to make sure that you are releasing your feet every day. So use a lacrosse ball, a neuro ball, a golf ball, and you're massaging those muscles because they are inherently going to be working harder out of structured shoes. So in minimal shoes, your feet have to work more. That's the whole point of them. But your feet are designed to withstand that capacity of work. You just have to recover them so that you don't overload them. So that's just part of what this gradual transition is all about, is you're trying to control the stress to the foot by balancing the recovery and the time in the minimal shoe.
So one thing I've been doing for years, it started out as kind of an alternative medicine thing, kind of woo-woo. Now we know there's a lot of science behind earthing, aka grounding, in terms of adding electrons to our body. Can you speak to that in terms of how you use it in your practice?
Yes, so I love earthing as well. And for that, I would have people do it again, think 15 minutes every day if they can. It could be as simple as, when you're in the backyard with the dog, like something to make it easily integrated into your day. But it's very good, and there is a lot of research behind this, as you know, that earthing or grounding is a very good way to support inflammation in the body, acidity in the body, supports microcirculation to the feet, can balance the circadian rhythm, good for sleep, obviously, because of the circadian rhythm. So I use it as a adjunct to everything else that I do. I try not to have it be, if you earth 15 minutes a day, every day, you will be cured of this problem or this condition, right? It is part of the big puzzle, which is your healthy longevity puzzle, which is the same thing as, your sleep, water, stress levels, supplements, diet, all of that is just part of that. But generally that's what I would recommend, is say 15 minutes every day. I've traveled to India before, and this is part of their pass through generations kind of longevity recommendation is to earth. And they recommend doing it first thing in the morning when there's the morning dew on the grass, because you actually get a better conduction when there's a little bit of water between you and the earth. So that's actually how they would recommend it, which I love that. So that's something people could do as well, is you could do it first thing in the morning, drink your coffee, walk around the front yard, something, and then get your grounding.
Get your morning sunlight also.
Exactly,
So you're
right? There you
killing,
go. Your
like
sunlight, your earthing. Yep.
there you
Exactly.
go. In terms of athletes and athletics, have you worked with a lot of athletes in general, specifically basketball players? And do you get a lot of pushback from the traditional medical community, the athletic trainers, etc.?
I have worked with all sports, all types of athletes. Yes, basketball, professional basketball, football, soccer, golf, you name it, where my goal is to get these athletes, we'll stay with basketball, better connected to their foundation and how they move or manipulate their body ground up. So, and obviously we know that then in a lot of these sports, we'll just use football and basketball as an example, which are shod, and everything is taught shod. A lot of the techniques are taught very center, core, glute, hip, lumbopelvic hip, and that's where your powerhouse is. So really your foot is just totally forgotten, and that power is just trying to hinge from the hips. Where when I go in and I've spoken to some of the strength coaches, or I've worked with athletes individually on their own coming to me, is teaching them that your feet are actually deeply connected to your pelvic floor and your hip muscles, and your glutes are only as strong as your core is stable, and your core is only as stable as your feet are strong. So I try to get them to feel and appreciate that connection. And when they do, it's obviously life-changing or career sport changing, because they're able to access a different level of body awareness and movement awareness. And honestly, it starts by getting them out of their shoes. They have to get out of the shoes, feel the ground, get the articulation of the digits. And then of course we know they're going to go back into the shoes because it's a shot sport, but the consistency of that freedom of that foot movement stays with that athlete even when they do put their shoes on.
Awesome. Yeah, I think that's great. And like you said, it's also interconnected from the foot to the pelvis. I mean, I've seen cervical spinal issues that might ultimately go back to the opposite foot or the ipsilateral foot. But in terms of great toe extensions, let's talk about the big toe. You need at least 60 degrees of extension for normal gait and jogging and definitely power output, correct?
Yeah, so the ideal, so if we were having an exam for the listeners, it would be 65 to 75 is their test question. But walking, you can get away with 30 degrees. If we stay with the athletics and like basketball, especially because they're jumping,
Mhm.
you definitely need to have more. And what happens is if you do not have sufficient dorsiflexion of your big toe, you'll still be able to jump, but you will most likely be pivoting the foot a certain way or picking the foot up earlier than you should. Kind of the best analogy when I teach people how to jump vertically from the ground up through their full digit extension into plantar flexion is that you need to have a follow through. So imagine throwing a basketball and you don't follow through, right? You swing a racket, you don't follow through. You don't make the shot, the accuracy of the movement, but also the fluidity of the movement. Where I'm big on teaching athletes of all sports, not just dance, but all sports, about the rhythmic and the grace and the fluidity of how they should be moving. There should be this effortlessness to how they move. And dancers are one of the best examples of people who do appreciate their feet and the ground because they understand that's where your energy comes from. And that's a huge part of why they move so gracefully and effortlessly. How do we try to bring a little bit of that to these shod sports like basketball and actually get full extension and follow through all the way to the tips of the toes versus cutting off that energy early because of insufficient range of motion or insufficient awareness about the foot?
Yeah, and in terms of dancers, so you brought up dancing, but if someone like I have a friend at my gym, his daughters dance 4 hours, 5 or 6 days a week. And so, long term, what kind of effects are we looking at on the kinetic chain?
I mean, dancers have some of the worst feet. You can always tell a dancer's foot, especially ballet, who has done point. They have this kind of classic foot presentation. So they definitely do take a beating, just like any other part of the body in a different sports. So that's where understanding foot recovery is very important. That's easily emphasized within the dance community because, again, they have such a deep inherent appreciation for the foot. But
Mhm.
similarly, I try to teach that to, let's say, a football player who's in a stiff, narrow cleat.
Mhm.
By design, they need that stiffness of the cleat to protect the joints and to create better accuracy when they kick the football and things like that. But even them, we need to help them understand foot recovery. They need to spread and open up the foot as soon as they're out of that cleat so that they don't get this compounding effect of foot stress, which leads to certain injuries or deformities within the foot. Because a bunion isn't really an injury, it's more of a deformity, right? Just from
Right.
repetitive stress. So they may not have any foot pain, but the alignment of the digits in the forefoot is not optimal for function, stability, movement.
Yeah, I'm glad you brought that up because it seems like so many shoes today, modern shoes, they push the toes together and you get that hallux valgus. So can you talk about that and what's ideal, what you want to look for in terms of a minimalist or barefoot shoe?
Yeah, so one of the biggest selling points when back in the 2008-9 was this difference between traditional shoes, which will either be pointed or very rounded. And as they round, they kind of push the big toe and the fifth toe in, creating a bunion and a tailor's bunion. Is that in the minimal shoes, they were demonstrating this wide toe box. The natural shape of the foot is, if you look at the shape of your foot, not in a shoe, and you essentially traced it, what should a shoe actually look like? It shouldn't be pointed or overly rounded. It should be kind of square-ish in a sense. So that was one of the biggest selling points. So something that the listeners can do is, if you're looking at shoes, you can take a sock liner out of the shoe, and which is the insole that comes in the shoe, put it on the ground and stand on it and just have an idea of the width of that shoe. And then if your foot is totally hanging off of that sock liner, the only way that your foot is going to fit in that shoe with that shape of that sock liner is that it's going to have to compress. So it's often a very good way to help demonstrate to people, oh, I see when I stand on this minimal shoe sock liner, my toes all sit straight and aligned is how they should be when I'm barefoot, right? So that was one of the biggest selling points, and that's what I encourage people to look for. A lot of people who follow my work and patients will actually use toe spacers. So they'll put like a toe spacer on their toes to spread them even more, and then go into a shoe. The
Wait, I thought
only
those were for pedicures.
No, no, no. No, no. So the toe spacers, which support natural toe alignment,
Uh-huh.
people will wear them in their shoes. But if you're looking for a shoe that you can fit with a toe spacer on your foot, it has to be minimal because
Right,
it makes them even wider, right? But
right.
a lot of people will do that, and they'll wear them in their Vivos or their Zero shoes or whatever brand that they want to wear. But yeah, these are awesome. The toe spacers are great if you have, say, bunions and hammer toes. Those are the easiest to connect to. But let's say if you have bunions and hammer toes, technically, every single time you take a step, you're making them worse. So they're progressive conditions or deformities. I don't know, that's a nice word to use, but these deformities progress every time you take a step. If you take 5,000 steps a day, every day, imagine how this just quickly accumulates to the progression of a bunion or to a hammer toe. So by using toe spacers on your feet in shoes, you're essentially splinting that progression effect.
Okay, awesome. Let's talk about nutrition and supplementation. How do you approach that with patients who say, "Oh, Dr. Emily, I came to you because I have a problem with my foot. Why are you talking to me about what I eat?"
So yes, so everything, whether what you eat, supplements you take, you are trying to navigate how to, you're trying to navigate your body's natural inflammatory or healing processes. Like that's how I'm looking at it because of what I'm presented with. So one supplement that I will use with patients and discuss with them are systemic enzymes. And the benefit of systemic enzymes is that they are naturally modulating the inflammatory process. They are also naturally antifibrolytic. So I like that they can break up disorganization within connective tissue, let's say the plantar fascia, the Achilles tendon, but they'll also help to navigate the inflammatory cycle that sometimes people get stuck in a phase of the inflammatory cycle, and we can help them kind of finish getting past that first phase. So that is one of my favorite ones that I will use. In my office, I also do regenerative injections. So I do primarily Wharton's jelly injections. And when I do them, let's say for a partial tear of the plantar fascia, if I have a partial tear in the plantar fascia, which is disorganized connective tissue, I explain to them that's almost like a haystack that is kind of hodgepodge. It's very chaotic, that we are trying to break up and organize this chaotic situation through the Wharton's jelly, which has growth factors. So it's, again, supporting the body's natural healing response. And then I do red light therapy on top of that. I will do systemic enzymes on top of that. So I try to stack what I'm doing regeneratively. So that is oftentimes one of the most often recommended supplements, especially in this situation. Some other ones that I may recommend, or I'll talk to them about their diet, is neuropathies, because neuropathies are very much based around blood sugar levels and free radicals, but also inflammation. So if it's their diet that is triggering high inflammation or excess blood sugar that is essentially being oxidized, that's not good for your nervous system. So then recommending things like arlopoic acid, acetylcarnitine, L-methylfolate. So there's some that are highly researched that are beneficial to the peripheral nerves. So that would be one other situation that I often recommend supplements.
Awesome. Marcel's gonna post your bio and your links and everything, but do you do virtual consultations for people, whether they're weekend warriors or pro athletes or just, whatever the case may be, and they just want some advice on lifestyle, shoes, footwear, etc.? How can people find you?
Yeah. So yes, I do virtual. I do in person as well in Arizona, but a majority of my patients are virtual just because of the convenience of our telemedicine phase of where we are. So it works great. And most of my patients, they come to me because they are looking for another opinion that is out of the box. So not going to think very traditional in the approach podiatrically or feet wise. I will look, as we discussed, very integrative wise. So I will want to understand their pelvic floor, the way that they breathe, because that's connected, obviously diet and supplements and things like that. So that's where I see most of my patients. I see a lot of chronic conditions because they're not responding to other traditional techniques, or they're trying to, again, think of something outside of the box, any of the regenerative. And then I also actually see a lot of people who are just proactive in wanting to take care of their feet. They're like, I don't have any feet problems, but please, I just want to spend an hour with you and just look at my feet and tell me what I can do to like bulletproof my feet. And I love that patient because they are very ahead of the game. They take their health into their own hands. And they just kind of geek out on all of the stuff that I often recommend. So my podiatry website is my name. So it's dremilysplichal.com. I am on Instagram. My handle is the functional foot doc. So you can also find me there. And then on YouTube. So if someone wants to just start by seeing some of the videos, I give a lot of lectures. I do a bunch of exercises on the internet. Then they can just go to YouTube, and really I would just search my name, Dr. Emily Foot. Just put that into the search and you will get many videos of exercises and lectures.
Awesome. Well, thank you so much for the work that you're doing. Thanks for being an out of the box thinker. There can't be very many regenerative medicine podiatrists. At least haven't heard of many. Are there?
No, and I get asked all the time of, oh, is there someone who treats like you in my area? And unfortunately, there's not, but it is my goal. I've a education company for fitness professionals, and that is a very well-oiled machine right now, that it is my goal to then start a professional organization for podiatry and teach them about functional and regenerative podiatry, so that the next generation of podiatrists are coming out of the gate or coming out of residency thinking and appreciating integratively and holistically, and factoring in things like glute strength, right? Shoulder, things like that, which is very influential to foot function.
Absolutely. Well, thank you so much. We know you're a very busy woman, and keep up the great work. And hopefully we can have you back on sometime in the future.
Thank you so much. It was a pleasure.
All right. Take care.
Thanks.